Hi everyone, my name is Jess and I'm a clinical nurse specialist with Smileyscope. I'm here just to run through a little bit of an in-service to talk about the background about us and how to use Smileyscope in your everyday practice. So Smileyscope was developed in Melbourne by two doctors. So Evelyn was working at the Royal Children's and Monash Children's Hospital, and she was doing lots of bloods and lots of cannulas and really seeing firsthand the direct impact needle anxiety and needle phobias have for her patients and also their parents. And Paul is an adult pulmonologist, and he was seeing a lot of delay in returning to healthcare, as well as some of his own patients having these needle anxieties that have just been built up over the years. So they both came together and created Smileyscope. So when creating Smileyscope, Evelyn asked 100 of her patients, where would you be right now if you were anywhere other than in this room? And majority of her patients said either swimming or at the beach or in the pool. And so she kind of went off that timeline and said, okay, well, what would the tourniquet be? And a lot of the kids said, well, when we're swimming, we're wearing our floaties, so we could pretend it's our swimming floaties. And then she said, okay, well, what would the poke be? And a few of the kids said, well, when we're swimming in the ocean, sometimes we brush past seaweed and sometimes fish brush past us, and we could pretend that it's fish nibbling. So that's where this therapy mode came from, was kid imagination. And it is a choreographed program to go along with you as a clinician when you're doing a procedure such as like an IV or taking bloods. So with this one, as I said, this is your underwater adventure that your patient's going to go on. They begin above the water and there's a little penguin that's going to take them down. It will say to your patient, you'll feel a cool wave wash over you. That's when you do your alcohol swab as a clinician. It will say to the patient, those fish you can see might come up and have a little nibble, but it's okay. That's when you'd be doing your cannula or taking your bloods, sort of any sort of procedure. And you don't just have to use this for a cannula, you can also do it if you're doing a wound dressing or accessing a port. The good thing about this is we've got different sites on the body that you can choose for it, so the patient will be able to virtually see those sites. So after coming up with that therapy program, a study was conducted at two of the big children's hospitals in Melbourne in their phlebotomy unit and their emergency department. And it was standard of care versus standard of care with Smileyscope. So with your standard of care, patients were still able to use distraction tools like iPads, phones, sort of anything like that. But we found that when they were using Smileyscope, as you can see, there's a big reduction in child pain, child anxiety, the need for restraints, but the biggest one we found was that caregiver related distress. And sometimes as a clinician, when you're doing a procedure, sometimes you're really focused on them. Sometimes the parent is sort of stuck in the corner and they're really anxious. So we found that when the patient was really calm, the parent was also really calm. And so we like to say the phrase of contagious calm, but you can see Smileyscope really does help to reduce that caregiver related distress. So I already spoke about the therapy mode, but we've got over 40 experiences now on our headsets that you don't just have to use that when you're doing a procedure. So the next one I like to talk about is our breathe mode. So this is where your patient's under the water and there's a big air bubble blowing in and blowing out, and it says to your patient, take a deep breath in, deep breath out, deep breath in, deep breath out, and it's just going on repeat, and it's really getting them to take those deep breaths and try and calm down. This is great if you're doing nitrous or nebulizers, or if you've got a really anxious patient. This is a really great one to use. Next, we've got our relax mode. So this is where you can watch your puppies, your kittens, you can swim with seals. There's a tour of Kenya on here now. There's also a tour of the butterfly sanctuary in Melbourne Zoo. And so that's where you have a you have a zookeeper talking to you about all the different butterflies, how to take care of them, where they come from in the world. And so those ones are really interesting to listen to, and I find a lot of the kids love that type of content. We also have a tour of Borneo and the orangutans there. There is also a roller coaster ride on here, snowboarding, and a motorbike ride. So there really is so much in that relax mode. Sometimes I'll even say to patients, hey, we've got this like really cool VR headset, do you want to have a look at it? And in that relax mode, I'll say to them, is there something you really want to watch? And then so we'll click the ones that they want to watch, and then that way they've got like a choice in sort of what's happening. We've also got some mini games on there. With these ones, your patient does need to move their head for the games. So I normally find if you're doing a procedure and you really need them to be still, I would use this as like an after procedure type reward, or even if your patient is just a bit bored or waiting for theatre, they can have a play with these. We also have 4 guided meditations. So there is a relaxing beach. There is also a forest of serenity with David Attenborough's voice over the top of it. And we also have a cherry blossom tree, where with that one you've got a glowing light going around it, and it's going through box breathing, so it's getting your patient to do deep breathing exercises. And we also have a relaxing lake as well on there. With these ones, they're really great for our adolescents and adult patients because they're just more meditative, and really gets the patient to sort of take a step back, take a few deep breaths and calm down. The next one I like to talk about is MRI, mock MRI and mock CT. So with the MRI, it can't go into the MRI machine, but it can go into CT. So with your mock MRI, this is to get your patient ready for the procedure and to try and reduce the need for sedation. So there's a few different options you can choose, one of them being realistic, which is exactly what it's going to look like. We also have a bakery mode. So this is where your big MRI machine looks like a huge donut, and your patient's going into the donut making factory. If they lay really still on the table, little donuts will form above their head, but if they move, they're going to knock over, and then they get a star rating at the end. Some places, medical imaging places, actually go off that star rating to really determine, can this patient go through the MRI without sedation. We also have a space version on there as well. And the good thing about this, as I said, you get a star rating, so your patient can do it as many times as they need to really prepare themselves for that MRI or that CT. It also goes through all the sounds that they're going to hear as well. With the CT, you've got the option of contrast or not, and so that goes through what contrast feels like through your body. You know, it's a warm feeling. You might feel like you need to use the bathroom. It's a safe space. So it really covers all the aspects of what is going to happen for your patient. So Smileyscope really does have benefits in every department in the hospital. Say you've got a patient coming into emergency, query appendicitis, more than likely you are going to do bloods and a cannula. So you could use the therapy mode, you could use the relax mode to do your cannula. If they're then going for a CT, you could get them to watch the mock CT to get them used to it. They can also take it into CT. If they are waiting for theatre and they're a little bit bored and they're a bit hangry, they can have a look at the puppies and the kittens. They can play some games on there. After theatre as well, even if they're on the ward and they're just recovering and they're a bit bored, they can use it there. So we really do have so many uses throughout the whole hospital. So now I'm going to show you guys how to use it. So this is your VR headset here. This is what it looks like. This part here is what we call the faceplate, and so it just pops off. It's just magnetic. When you first get it, you want to hold that red button down, and that's going to turn it on. It will then come to this main page here, which is your home screen. If I want to do a cannula and I want to use the therapy mode, what you're going to do is you're going to press therapy, you're going to press get started, and then it will take you to this page here. With this page, this is like your settings page before it will play. So the first thing to note is in this top hand corner up the top here is a little word that says English, and you can change the language, and we've got 12 languages on there, so it's majority of languages that you would see. We then have different ages here. So there's child, teen, and adult. The only difference between child compared to teen and adult is just the voice is chirpier and more childlike. Then you've got your session times here. If you were doing bloods or a cannula, there's 1 minute, 3 minute. If you were accessing a port, there's up to 7 minutes, and then you've got your volume on the bottom. Because this one is choreographed and you want to hear what your patient hears, it's important that you've got the volume quite loud. I'm going to keep it off for this because it's going to talk over me, but just note that when you are about to use it, to put that volume quite loud. Another thing I recommend is to everyone just use this on the 1-minute version a few times before using this with your patient, because then you really know what the cues are going to be and when you need to time up what you're going to do. After I've set everything up, I press start, and then I've got all the different sites on my body. So you've got chest all the way up to intragluteal. I'm going to choose this one. I'm going to press start, and then it will come to this page here. No matter the VR experience you've chosen, say if I'm choosing relax mode and I've chosen them and I press start, everything is always going to come to this page here. As you can see, this moves around and it's going to calibrate to your patient's eyes. So the most important thing is before you press anything, you need to put it on your headset, put it on your patient in the position they're going to be in. So say they're going to lay down, get them to lay down, put this on, then you press this green button 3 times and then it will start. And the reason you need to do that is because if I set it up here and I turned it on and I turned around and gave it to my patient, everything's calibrated to my eyes. So your patient is going to be looking all around. It's not really going to make sense for them. So that's why you got to make sure the faceplate's on the headset, on your patient, then you press the green button 3 times to start. So next we have meditate. So again, it's the same thing. You choose the one you want, you press get started, and then it's going to come to this page here. A good thing about these ones is that you can press all the ones you want and they're just going to cue on the right hand side and they're going to play automatically. So you don't have to worry about one finishing and then you have to take the headset off and play another one. It will just go automatically. The next one I like to chat about, so you've got your breathe on there as well and you've got your mock MRI. With your relax mode, same thing, press the one you want, press get started, and then it will come to this page, and this is where you've got all your different options on here. So there really is a lot of content to choose from, and it's the same thing. So you can choose all the ones you want, it will cue on the right hand side and it's going to play automatically. If I'm doing a procedure and say I don't know how long it's going to go for, I normally will press a bunch of them so it goes automatically, and again I don't have to worry about it stopping and then having to take it off mid-procedure. If you have any new staff joining the ward, or you have someone who's like missed out on training, we've got the learning option here. That's just for you guys, and then so this just basically goes through what I've spoken about. In terms of cleaning, it is any alcohol-based wipes, so your Clenel wipes are fine, just nothing with that brown iodine because that will obviously stain. When charging, it's just this little charging port here, which is your USB-C charger, and it takes about an hour to charge and lasts about 6 to 8 hours if you fully turn it off in between. With your headset, if you have someone who doesn't like straps touching their hair, or say you have a patient wearing a hijab, you can just take the straps off and just have them hold it, or have their parent hold it. One tip when doing nitrous, this little blue section here kind of looks like a headband. You can push it down and pull it up, which gives you the ability to get a really good seal with your nitrous mask. So some common errors that we see is when the headset isn't properly fitted. So you want to make sure that this little triangle at the back here is at the back of your patient's head, and you can just use these little clips here to adjust it. I normally get it adjusted before I'm going to do the procedure, just so then it sort of runs smoothly. There's also some contraindications that I need to talk about. So patients not to use Smileyscope on would be patients who have like a programmable shunt, if they have epilepsy, sort of any contact infection control in the head or open wounds in that area, neuromuscular compromise, any known hypersensitivity reactions, and also your unstable or deteriorating patients, but you would be able to make that clinical judgment. And then again, this is just not to go into MRI because it does have those magnets in the front of it. So that is it for this video. If you have any questions or want any further educational in-services, please feel free to reach out. My details are just there. I'm more than happy to run through some more education sessions, especially if you have new staff starting. But thank you so much for watching, and all the best.